to drive them to traditional Medicare where you can control them better. Isn't that the case?
Senator Kennedy.
Thank you, Madam Chair. Thank you, Mr. Secretary, for being here. Mr. Secretary, if the mother is healthy and the baby is healthy, do you really support abortion of the baby up to the moment of birth?
Senator, let me make sure, to the moment of birth, you're saying after gestation, the 40 weeks?
You know what I'm saying, Mr. Secretary.
Well,
Let's suppose it's the day before the due date, and the baby is fully formed, and the baby's healthy, and the mother is healthy. Do you support aborting the right to abort the baby then?
I've heard no one say that. I think everyone has said, those who support reproductive rights have said,
support
Roe versus Wade.
You said it in 2020 in a press release. This is what you said. You said, quote, "No government, state or federal, has the right to make decisions for a woman about her body or her health care," end quote. Your words, not mine.
Good words.
So let me ask you again. Up to the moment of birth, if the mother's healthy and the baby's healthy, do you believe that there should be the right to abort that baby up to the moment of birth?
Again, I'll give you the answer. I have always supported Roe v. Wade, which does not do what you've just said. And I know of no one who is proposing or advocating what you've just announced. And I would hope that what you would recognize is that that should not stop a woman from having the right to decide for herself, with the consultation of her physician, what she should do.
Would you support making it illegal to abort a baby if the mother's healthy and the baby is healthy on the day before that baby is scheduled to be born?
I certainly would support the reestablishment of Roe versus Wade.
Okay. So you think that there are restrictions that the state, federal or state, as the case may be, can place on abortion?
Senator, if you talk to any woman, she'll tell you that she uses common sense in making her decisions.
Do you think that the state or the federal government in the third trimester of a pregnancy has the right to impose limitations, moral and legal right to impose limitations on an abortion? I think that's a yes or no.
I would certainly say that Roe v. Wade answered those questions. We defend and support Roe versus Wade.
Roe v. Wade has been overturned. I want your answer. Do you support restrictions by the federal or the state government on the right to an abortion in the third trimester?
And my answer is clear, that if we establish Roe versus Wade, we get back to a system that gives women protection.
Do you support restrictions to the right to an abortion in the third trimester? Why are you dodging the question?
I'm just saying, I'm telling you where I am.
Now, tell me, do you support restrictions in the third trimester?
I have
if
personally.
The mother's healthy and the baby's healthy.
Yeah, and Senator, let me try to make sure I answer this. Personally, as you mentioned, I've been quoted on a number of occasions before I became secretary. I support a woman's right to make a decision about her body.
But do you support restrictions in the third trimester? I just asked, why are you embarrassed to answer?
Because I believe in Roe versus Wade, and I think everyone recognizes
that law. You support Roe v. Wade?
I do.
Roe v. Wade allowed for restrictions in the third trimester.
Then you have your answer.
Do you support restrictions in the third trimester?
If Roe versus Wade is as you described, then
why are you scared to answer the question?
I'm not afraid to answer. I'm
asking. Are you worried you're going to get in trouble with people, with your colleagues?
No, not at all.
Abortion up to the moment of birth?
Not at all.
Then why won't you answer the question?
Because, Senator, I think I've given you the answer that makes the most sense. Roe versus Wade worked for some 50 years.
Do you support restrictions in the third trimester on the right to abortion? It's real simple. You're the secretary of a department of the United States of America. Yeah. Do you support them or do you oppose them?
My answer is pretty simple. We will defend Roe versus Wade.
You don't want to answer it, do you?
I've answered.
You know why you don't want to answer? Because you and your colleagues believe that a child has no rights, even a fully developed child. You know that?
You can say that.
And I know
where I am. I will continue
Okay,
to
let me
defend a
ask you
woman's
for a
right.
final time. I think this is number 5.
It's not gonna make any difference, but go ahead.
Yeah, well, if you want to choose to not answer it, that's up to you.
I'm not denying anything.
Let me phrase it another way. What restrictions do you support in the 3rd trimester to the right to an abortion? Tell me what restrictions.
If you read the Roe versus Wade decision, it'll answer your question.
Why don't you just answer it for me?
I did. Roe versus Wade
What
established the
restrictions
protection.
do you support on the right to an abortion in the 3rd trimester? You
Roe versus
personally.
Wade. Roe versus Wade.
Okay. Roe versus Wade doesn't say what restrictions. Roe versus Wade just says the state and the federal government have the right to impose restrictions. I'm asking you, what restrictions you support? For example, if the mother and the baby are healthy, and we're a week before birth, and the parents change their mind and say, we don't want a boy, we want a girl, abort the baby who happens to be a girl, would you support that right?
I know no one who would go as far as what you're indicating.
Well, then wouldn't you say you would oppose it?
Because I'm telling you where I stand.
No,
and I
you're
have
not.
been very
You're
clear on that
dodging
for a
and
long
lobbing
time.
and weaving and flip-flopping
No.
like a
Let me
mad
stand as still as
catfish.
you'd like. Senator, I won't move, and
Let me
I'll just
ask
move
you
my
again.
lips.
If a week before birth, baby healthy, mother healthy, would you support the right to an abortion because the parents dislike the gender of the baby? Yes or no?
Yeah, as I said, a woman should have the right
But you
to make the
haven't said,
decisions
Mr.
about her body.
Secretary, you won't answer my question. Would you support that?
As I said, I'm going to do everything I can to support a woman's right to make the
Would you
decisions about
support
her
what I
body.
just described? You're not going to answer me, are you?
Senator Hyde-Smith.
Thank you, Madam Chairman. Good to see you, Mr. Secretary. Thank you for being here. In 2003, Congress established the Rural Community Hospital Demonstration Program to test an alternative payment model for rural hospitals that were facing certain financial constraints with the Medicare's Inpatient Prospective Patient Program, the IPPS. And Congress has extended the program several times, most recently in the Consolidated Appropriations Act of 2021. But Mississippi ranks among the states with the highest rate of hospital at-risk closings. This demonstration program could serve as a means to keep their rural hospital doors open to serve their communities in need of high-quality health care. However, CMS has not solicited applications since 2017, despite, as I understand it, there being a handful of open spots in the program. Do you believe this program has been helpful to rural hospitals facing closure, and we should extend the program when the time comes?
Senator, thank you for the question. The rural emergency hospital designation extended a lifeline to some of these facilities. It is absolutely essential that we give hospitals that are willing to stay open a chance to survive if the older version definition of how they could get reimbursed isn't working for them. So we look forward to working with you because we've got to figure out a way to keep some of these facilities open and operating.
Do you know about how many spots are currently open right now in the program?
I don't have that with me, but I can make sure my team follows up with you.
No problem. And can you commit to working with me to solicit applications for the program and find ways to help us keep these hospitals open?
Absolutely.
I talked to administrators this morning that have been in my office, and we are constantly battling this in Mississippi. You know, we're just putting out one fire after the other. Mississippi has consistently seen some of the poorest maternal health outcomes in the nation, made worse by high rates of chronic disease and limited access to specialty care for many mothers. And we've also led the nation in infant mortality, something that we're not proud of at all and very concerned about, but it's driven largely by a very high preterm birth rate stemming from lack of prenatal care. Access to maternity care in rural areas is a major challenge, and we are seeing a rapid expansion of OB deserts, that we refer to them as, across Mississippi. In some areas of my state, women are having to drive more than an hour for any kind of obstetric care. How can we work with you to improve outcomes for our mothers and babies in Mississippi?
Senator, because everything you've said I agree with regard to maternal health, and especially how it's impacting our Black and Native American communities. The most important thing is early access. And as you've mentioned, sometimes, especially because a state like Mississippi has a lot of rural communities, it's tough to have access. And so that's why it is so important to not allow any existing health facility to go under in rural America, because then the access becomes even more difficult. Telemedicine, telehealth is going to be very important for communities, families in rural America, because it means they can have access without having to do the physical travel. We'll continue to support that so long as Congress gives us the flexibilities to offer telehealth flexibilities. But the most important thing is access. And I will simply say here, many of the women who are having bad outcomes could have qualified for earlier care had they been eligible for Medicaid. And I think if we expand Medicaid in some of the states that haven't yet done it, about 1.5 million more Americans, many of them women who want to deliver a baby, would have access to early care and not wait until it's a difficult circumstance in the delivery.
Yeah, well, I appreciate your concern and your willingness to help toward this, because it truly is crucial. Mississippi's a large state. We don't have many people, but we're a large state.
Yes.
And we're scattered. And it is truly a hardship on so many mothers to actually get to that care. We have a lot of babies born in cars, sad to say. My time is out. Thank you.
Chair Murray.
Well, thank you very much, Chair Baldwin. Secretary Becerra, good to see you. I appreciate you joining us today. HHS really is on the front lines of some of the most challenging issues that our families are facing. Opioids, mental health, childcare, so much more. It is crucial that we maintain strong investments in life-saving biomedical research, building a strong healthcare workforce and public health system, getting families affordable care close to home, and a lot more. Not to mention the constant attacks on reproductive care. Women in 21 states are now living under abortion bans, and Arizona is under a ban that dates back to before women even had the right to vote. Despite strong support for abortion access around the country, anti-abortion extremists are continuing to attack not only abortion care, but IVF and birth control. Everyone, I believe, deserves the freedom to control their own bodies, their own lives, and their own future, free from interference from politicians, which is why I strongly support President Biden's decision to once again remove Hyde from this year's budget. I look forward to continuing to work with you to protect reproductive health care every way we can in all 50 states. And I'm glad we have the opportunity today to talk about how we can provide the resources necessary to meet all the health care challenges before us and support families in my state and across the country. Programs like Child Care and Development Block Grant and Head Start are a lifeline for working parents who need affordable, high-quality child care and early learning opportunities for their kids. They are an investment not just for our families, but in our workforce and in our economy. So I'm really glad that Senator Baldwin and I were able to send an increase of $1 billion to the President's desk to invest in child care and early learning for FY24. Since 2015, I and many others have increased funding for these programs by more than 250%. But it is, as you know, a drop in the bucket when looking at the child care crisis that exists in this country. We need to protect and strengthen the investments we've made to make sure families can find and afford child care however possible. That means more annual funding, extending stabilization dollars, and hopefully passing my Child Care for Working Families Act. Can you tell us today about the current state of the child care sector and why investments in programs like CDBG are critical now more than ever?
Senator, thank you. And again, thank you for championing child care writ large and your success in getting additional funds for so many families desperately in need. Today, getting child care is like having your infant go to college. The cost of child care is essentially tuition in a major university. It makes it very difficult for parents, especially parents who have more than one child, to really sustain that. We also know that the the quality of care can sometimes be questionable because the pay for some of these workers is so low. You can sometimes make more money flipping burgers than caring for children. We need to change that as well. The president's budget, thanks to the investments that many of you have made possible, will continue to move an effort. The president's proposal would make it possible for some families to qualify to have child care for $10 a day, which would ultimately save them each, those families, about $7,200 in a year in the cost of their child care when you total it up. That would be a proposal that would help so many of the families, some 16 million families would qualify for that support. And so it's so important to move forward, as you said, to continue to make the investments in child care.
Thank you. I really appreciate that. We'll continue to focus on that. Mr. Secretary, this week is Black Maternal Health Week. It's an important time to talk about the devastating maternal mortality crisis here in the United States. The U.S. is now one of the most dangerous places in the world to give birth, and that really is astounding to me, despite most maternal deaths being preventable. It is clear our systems are failing mothers, especially Black, Hispanic, and Native mothers who experience the highest rate of maternal mortality. And extreme state abortion bans passed since the Dobbs decision have further eroded the access to maternal health because we don't have as many providers for maternal health care across our country. We were able to secure a $21 million increase for the Improving Maternal Health Initiative across HRSA, CDC, and NIH in our FY24 bill, and building on increases from 23, and I hope to continue that progress in this budget. Can you talk to us about what HHS is doing now to address this issue and about the additional investments in maternal health that you're actually proposing for next year?
And again, because of the efforts of you and others, we've been able to continue to increase the funding of maternal health. This budget, 2025 budget by the president, provides close to $400 million for maternal mortality and morbidity. To address that, because as you mentioned, in too many cases, a Black woman is 2 or 3 times more likely to die at childbirth than a white woman. I think I misspoke and said $8 billion. It's actually $2 million in this federal budget by the president is dedicated to maternal health. We are now, as I mentioned earlier before you got here, Senator, making available care for a woman who qualifies for Medicaid and for her baby, rather than just for 60 days, she now qualifies for 365 days of care, and so does her baby. We're doing a lot. Doulas are being made available to families. We're trying to do what we can up front before the delivery, so the woman gets good care before delivery, gets good care during delivery, and good care after delivery.
Okay, very good. And finally, on youth homelessness prevention, I am laser focused on making sure the federal government is doing everything we can to support young people who are experiencing homelessness and doing more to prevent it. I was very proud to champion new funding in our 24 bill for a demonstration program that will provide grants to state, local, and tribal governments and local organizations to help prevent youth homelessness. What is HHS doing to address and prevent youth homelessness?
Senator, thanks for that work that you're doing. We are working with states. I'm the chair of our Interagency Council on Homelessness, working with HUD and other agencies to make sure that we're tackling homelessness with the support of the local governments who actually have the day-to-day responsibility for it. I will tell you this, we are focused on getting families and children first and foremost off the streets. We're trying to make sure foster kids don't fall into homelessness once they age out of the foster care system. And so we're doing what we can. And by the way, we're also focusing on LGBTQ young people, because we know so many of them end up becoming homeless. And if we get to them early, we can keep them with a family, we can keep them healthy.
Thank you. Thank you very much. Thank you, Madam Chairman.
Next, for a second round, we have Senator Capito.
Thank you. Thank you again, Mr. Secretary. We authorized ARPA-H it was funded at $1.5 billion, and you're requesting flat funding for ARPA-H. For those who don't know what that is, it is intended to fund high-risk, high-reward research to find biomedical and health breakthroughs. It's fashioned after DARPA, which is done in the defense arena. And biomedical research has long enjoyed bipartisan support, of which mine is obviously part of that support. I have heard some concerns about either repetitive or deflecting or competitive maybe research that could be that's conducted at NIH as opposed to ARPA-H. So ARPA-H reports to you, and NIH is a separate entity. And I would like to know, can you tell me how you plan to make sure that the research activities of ARPA-H and NIH remain distinct? And I mean, I don't think they should be siloed because one can feed to the other, but to avoid that duplication.
Senator, so just to be sure we're clear, both NIH and ARPA-H report to me, but ARPA-H, which is very similar in its research mission, some said should have been housed within NIH. What we did was we kept it separate because it's supposed to be a much more nimble operation. The difference, basic research is done at NIH. It may take 10 to 15 years before we see some novel discovery come out of the NIH research. ARPA-H says in 2 years, no more than perhaps 3 years, you're on the ground with this novel approach. And so ARPA-H was, as you mentioned with DARPA, with the Department of Defense, to help us get those innovators who are having difficulty finding enough money because it's a small idea, actually get them off the ground. And so this is where that cutting-edge research will quickly get moving. And so ARPA-H has actually had some great successes. And as I mentioned to you in our conversation, I'd love to make sure that if you'd like, we let you know some of the projects that are underway at ARPA-H.
Yeah, so I understand your longest project so far is 9 months old. I mean, that's because this is a new program.
Correct.
You have the ability to withdraw funding at any, but I don't know how many projects you have going, 9 to 10 maybe going right now. You have the ability to withdraw funding if it looks like these things are, that's some of the hardest things to do, as we know.
Yes.
We served together. Have you withdrawn any funding from any of your projects that are moving so far? Is it too early to tell?
We're only 9 months in, and so usually 2 to 3 years, but you're right. These program managers are hired with the understanding 2 or 3 years, and that's it.
And so do you have a firm and affirmative oversight plan to make sure that you're redirecting funds if somebody's got an idea that's not going to work, let's move on, and you have that oversight plan already in place? Yeah,
Dr. Wegerson, who, by the way, came from DARPA, Dr. Wegerson understands that completely. It's in the design of the proposals. Everyone understands this is not going to be something that's living for a decade. It's either you hit it, you have success, or we're moving on.
Okay. I want to ask you about your return to work process. COVID's over. It's been over for over a year now. The White House Chief of Staff, Jeff Zients, and I excuse him if I pronounce his name incorrectly, encouraged agencies through an order in May 11, 2023, to bring back in-person work policies. What is your in-person work requirement?
We are complying with the OMB guidance that was put out there.
Well, what is that? I don't know what that is.
It essentially says make sure that your work plans with all of your employees have a mix. So some are full-time, some are have some telework ability. And so it's having the mix, and what you're traditionally trying to do is have at least half of your workforce in at all times.
Okay, so approximately what percentage would you say is back in the office 5 days a week?
As I said, we're complying with the OMB guidance.
Well, I mean, I know.
So that means we're essentially there, but we're 90,000. We have people throughout the country. We have a mix. Unlike other agencies, we have folks who are medical
Have you
providers.
negotiated any contracts or with the federal unions that say you have to be in 2 days every 2 weeks and a day is 6 hours?
Yeah, we've negotiated contracts with the unions to make sure that we're complying with the OMB guidance.
Well, I mean, are some of those like that? Because I know we're finding that in other agencies.
Yeah, for example, telework has been around for a long time, and so we may have made adjustments to the telework plans that we have, but what we have to do is because they're under an employee collective bargaining agreement, we have to discuss that with you.
So can we have your collective bargaining agreements? I mean, I'm sure they're public, so we could see what you've negotiated in certain areas. Because quite honestly, 4 days a week, a 2-week period, 6 hours is a day, most of America would begin laughing at that.
Right, and that's not something that you have for the 90,000 people in the workforce. But let me see what I can do as far as providing you some of that information.
All right, and then I think my time's up, so I'll let these guys go ahead. Thank you.
Thank you.
Senator Kennedy?
Mr. Secretary, how many employees does the Department of Health and Human Services have?
Roughly 90,000, Senator.
And your testimony is that that half are back in the office full-time and half aren't?
That the OMB guidance essentially calls for a process where we
I
could have
understand the
physically.
OMB guidance.
Yeah.
Is it your testimony that half are back of those 90,000 are back in the office full-time and half aren't?
My testimony is that we are in compliance with the OMB guidance on how we handle the workforce.
Is it your testimony that half of the 90,000 are back in the office full-time and half aren't?
Again, my testimony is that we are complying with the OMB guidance. Like, we can make sure you know what the guidance is, so
I do
you know what we're
the
complying
guidance
with.
is. I'm just trying to understand how you've implemented it. What percentage of your employees are back in the office full-time?
I could try to get that information back to
You
you
don't
because
know?
we have a mix. I came to talk about the budget, but I can try to
You
get
don't
back
have
to
any
you.
idea how many of your 90,000 people are back in the office full-time?
I can tell you the types of mix of employment that we have.
Yeah, but that's what I'm asking. You got 90,000 employees.
That's right.
How many are back in the office full-time? What percentage?
And as
You
I
don't
said,
know?
this is a budget hearing. I came to talk about the budget.
Yeah,
if
but you don't know. You don't know how many of your people are back in the office full-time.
I can get back to you, Senator.
I find
I
that
could get you as
astounding.
best I can a response to that particular question, but I came here to talk about the
Why
president's budget.
is Medicare Advantage so popular?
I'm sorry?
Why is Medicare Advantage so popular?
Why is Medicare Advantage so popular? You'll have to help me with, what do you mean by
You
that?
don't know what Medicare Advantage is?
I absolutely know what Medicare Advantage is.
Yeah,
When
why
you
is
say
it so
popular, is there some survey that you're talking about, or what?
Yeah, I deal in numbers.
Okay.
About half of our seniors who qualify for Medicare choose Medicare Advantage, don't they?
That's actually more than half.
Okay. And why is that? That makes it popular, right?
Medicare Advantage today, this is the first year that we've seen more individuals select plans in the Medicare Advantage
Why is it
managed
so
care program.
popular?
Again, when you say popular, I've heard many Medicare beneficiaries who are complaining about being stuck in a Medicare Advantage
Well,
plan.
is it because the average person, average senior on Medicare Advantage pays $2,400 less in premiums on Medicare Advantage as opposed to traditional Medicare, plus gets more services like dental and vision in many respects? Could that have something to do with it, you think?
I'm assuming that you've seen some polling or surveys that give you some of those answers. I've heard many, many things,
No,
both
I've
good
seen,
and bad about
I've
Medicare
seen the
Advantage.
facts. Are you telling me that people on Medicare Advantage don't save money in premiums and copays over traditional Medicare?
I have no
that your
doubt that some
testimony?
do, but I wouldn't have no doubt that some pay more.
I'm talking about the average.
Again, I don't know what numbers you're referring to, but I'm
looking
more than willing to
at the
discuss
numbers
those with
that your
you.
department puts out.
Okay, then what are those numbers,
The
Senator?
numbers say that the average person on
I'm asking if
Medicare
you could show me the
Advantage
numbers.
pays $2,400 less in premiums and copays and gets extra benefits. Is that right?
My understanding is they're also restricted in the doctors they have access to, the hospitals they have access to.
You're trying to destroy Medicare Advantage, aren't you?
We've actually provided an increase in funding for Medicare Advantage.
No, you haven't.
Sure we have.
You cut funding in 2023 by 1.1%.
That's absolutely incorrect.
And you next year you're proposing a 0.16% cut. And in fact, the Medicare
That's absolutely incorrect.
that's not incorrect.
That's absolutely incorrect.
And in fact, the Medicare trustees,
Senator, saying it doesn't make
the
it true.
Medicare trustees said that you've lost your mind. My words, not theirs.
Senator, saying something doesn't make it true. The dollar amount that we're giving to
You
health
have,
insurance
you
companies
have
under
cut.
Medicare Advantage
Are you telling
has
me today that
increased.
you have not cut payments to insurers in Medicare Advantage last year by 1.1%?
We are giving Medicare
denying
Advantage. Health insurance
Are you
companies
denying that?
under Medicare Advantage are receiving more money this year than they got last year from
You
Medicare.
cut them by 1.1%.
That's not a cut, Senator.
And you're proposing another 0.1% cut. In fact, I mean, you and President Biden say you will not touch a hair on the head of Medicare, but you're trying to destroy Medicare Advantage.
Actually,
look-
the president's budget extends the
Look-
life of
look-
Medicare
look at
beyond
the-
your and my lifetime.
Look at the numbers. In 2023, under your watch, Medicare Advantage patients saw on average a 12% increase in deductible and a 5%
The
increase
insurance
in
companies did that,
premiums.
not us, Senator.
And Florida and Utah and Wyoming saw their premiums go up 50%.
Okay, Senator, blame the insurance companies, not us.
Because you cut the payments to
Senator,
the
we did not
insurance
cut.
companies to drive them to traditional Medicare where you can control them better. Isn't that the case?
The fiction you're propounding doesn't resolve the issue that we have every year so far under this administration increased the funding for health insurance companies who offer these managed care Medicare Advantage plans.
Are you,
Thank you, Senator Kennedy.